from the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It's Thursday, October 6th. I'm Alexis Delcid. Welcome to All Things Heart. Every Thursday at 10 a.m., we give you direct access to our doctors so you can ask your heart-related questions. Here's what we're talking about today.
They had to do heart surgery on me pretty much immediately.
A checkup postponed during the pandemic leads to a life-threatening situation. How doctors saved a Lawrence man's life. They saved his life twice, actually. This time we're talking about aortic stenosis. It's one of the most common and serious valve disease problems. What it looks like when you have it, and the non-invasive way doctors here can treat it. And as always, we love your questions. We love it when viewers send their questions, so send them our way to YouTube, Facebook, or the All Things Heart email. You can find all those links right here on your screen. Now to the show. So many of us postponed a doctor's appointment or two or three during the pandemic. But for the man you're about to meet, who also happens to be an avid cyclist, it led to a potentially deadly situation. It turns out he had aortic stenosis, and this was not the first time he'd had a scare with his heart.
From the moment we meet Sean Tiener at his home in Lawrence, it's clear he loves biking.
Gravel biking's fun because you get to go out wide open areas with quite a bit less traffic and ride in those open areas and ride hills. Just ride miles and miles, peaceful and relaxing.
But it's not till his girlfriend starts talking that we fully grasp the extent of it.
He didn't give himself enough credit doing DK 200 5 times, so.
What did he do 5 times?
He did this 200-mile bike ride on gravel, and that's what he should have talked about, but.
We test the products and make sure that they're working as expected before they launch.
Biking is kind of Sean's life.
You got to get outside with them and use them.
But then again, Sean is kind of good at playing things down.
So how far back do you want to go? Do you want to go back to the aneurysm?
The Lawrence man's health journey began with a massive aneurysm in 2011, detected during a CT scan to look at his gallbladder.
They found it by accident, and they had to do heart surgery on me pretty much immediately.
His doctor in Lawrence sent him immediately to the University of Kansas Health System.
She told me that she'd already called KU Med. She spoke to one of the best heart surgeons in the country.
That surgeon, Dr. Trip Zorn, who it turns out is also good at playing things down.
He held out his hand and he goes, "Call me Trip." Like, he tries to diffuse and make you not feel like you're like seeing a doctor.
How many times has Dr. Zorn saved your life?
Well, it'd be twice now.
The replacement heart valve Sean got had an 8 to 15-year lifespan, and when year 9 hit, so did the pandemic, and Sean put off his regular checkups.
I had stretched that out because of pandemic and hadn't gone, but I knew I wasn't feeling good. I knew that things weren't great. I was feeling tired and wasn't exercising as much and feeling exhausted, and when I did exercise, my legs felt heavy.
When he finally went to the doctor a year later, his valve was leaking and narrowing. Aortic stenosis had set in. So much time had been lost. This time, Dr. Zorn and his team would have to work quickly to save Sean a second time.
Probably the last thing that I remember him telling me was that, "Hey, you're in good hands. We're gonna go ahead and put in the medicine that's gonna make you sleepy."
Sean Tiener is joining us virtually today with his amazing girlfriend, Maeve. Thank you both for being here. And here in studio, we have Sean's cardiothoracic surgeon, the fabulous Dr. Trip Zorn. Call me Trip Zorn. Yeah. And we also have interventional cardiologist and division chief of cardiology, Dr. Mark Wiley. You guys are fresh off surgery in the OR, which is why you're in scrubs. So you're like Starsky and Hutch, the tag team.
Would I be Starsky?
I don't know.
Yeah.
I can't remember.
Who puts the light on top of the car?
I don't know, but I'm not doing the hood slide.
Okay,
so,
fine.
Okay.
We can do that after the show.
Yes, okay.
Yeah. Thank you both for being here. I know you're super busy. Sean, I want to get right to you. How are you feeling? You look fantastic.
Thank you. Yeah, I feel great. It's been quite the journey, but it's kind of hard to explain how when you're feeling bad, and then it turns around and you feel great, and then you can tell. It takes that moment because you don't know it's coming, but it's awesome.
And Maeve, you must be able to see, no one knows him better than you. As you guys move through your life together now, what's the difference between now and before this life-saving surgery?
Yeah, I mean, a lot more energy to do things. Like I was telling you guys before, it was kind of tired for no reason and didn't like feel like doing anything. So after the surgery, it was like, we could tell like right away that he was feeling so much better.
I want to ask Dr. Zorn this question. Dr. Zorn, you had to move quickly. How serious was his aortic stenosis in your view, having seen so many of these cases?
So he's younger than a lot of patients than we have, and so he's in better health than a lot coming to us, but he had really severe aortic stenosis, and we know a lot about severe aortic stenosis when it gets to that point. And patients don't live well, and they don't live long, and the mortality can be as high as 50 to 60% within the first couple of years. And he was so debilitated from it because his baseline is so high of exercise and activity tolerance, and he was way down from where he was.
So Dr. Wiley, Sean is clearly very active. He does all of this cycling, hundreds of miles. How much harder is the heart working during aortic stenosis, and then what makes it so dangerous to have this level of activity and go untreated?
Yeah, it has to work significantly harder, and you can feel that, but you really can't feel it. The heart doesn't necessarily have a nerve supply, so you have to think about it from a pressure standpoint. So the heart has a lot of extra pressure when that valve doesn't open like it should. And it makes exercise dangerous because it puts that strain on the heart.
So Sean, were you still exercising when you were feeling this bad? Were you still going on those monster bike rides? What did it feel like to you?
I wasn't going the long distances, and that's when I started to notice that things were bad as I started trying to ramp up my training again, and I just didn't have the stamina for it. I just would watch people that I would normally ride with just ride away from me and get away, and I couldn't cover the ground up, and I got to the point where my legs felt heavy, and at that moment I started feeling like, all right, something's wrong. And then so I just started trying to go on walks, and even walks my legs would start to feel heavy, and at that point I could tell. I was like, I know something's wrong. I kept complaining to Maeve, and she's like, make an appointment, you have to go in. And I was like, I have so much to do. But yeah, I finally got in. And
well, thank God for Maeve, who's one of the heroes here. I mean, it takes someone who maybe is a little bit removed but still very close to you to make you go to the doctor. That happens in a lot of our lives. I want to talk about this procedure because Dr. Zorn gave you a new heart valve without any major surgery. Dr. Zorn, you went through his groin, and we have some YouTube videos we want to show while we're talking about this. But Sean, what was the recovery like?
it was fast. I think the groin pain was probably, honestly, it was the only thing that bothered me. And then you immediately noticed once that kind of subsided that I felt great. I could tell it's just kind of an immediate turn, and then the hard work starts trying to rebuild your cardio system and get back into shape. And but you can tell right away that you feel better, and it's hard to explain. It's like Dr. Wiley said, you're feeling something's wrong, but you can't really tell it's your heart. You just don't feel like you have energy. So it's an amazing turnaround once it's done.
I think that's a really good point that Dr. Wiley made, is that when I hear about a heart problem, I picture someone clutching their chest with pain in their heart or their arm. But what Sean is describing isn't what I would typically imagine for a heart problem. I want to go back to the videos that we have because I want Dr. Zorn, if you could describe what you did during the surgery to help us understand how it's possible to fix someone's heart through their leg.
Sure. So this is called TAVR, and that's TAVR, transarterial valve replacement. And you saw in the first depiction that we access the blood vessels in the groin called the femoral arteries, and we, depending on the type of valve we use, we usually put a sheath in there that basically is a conduit or a way to deliver it. And this is the valve, an animation of the valve that he got, and you can see there's a balloon on the inside of that. And what you see is it's coming up, and it goes up and over the arch of the aorta, and then that diseased valve is down at the bottom, and we have put a wire across it, and that helps to guide. That's how we deliver it into position. And this is an operation that's done both with a surgeon and a cardiologist there, because it's kind of multidisciplinary, kind of crossing specialties. So the delivery system is pulled back a little bit, and you'll see here in a second that we use what's called rapid ventricular pacing to just slow down the output from the heart. It actually paces the heart really fast, but it decreases the pressure and allows us to be a little bit more precise in where the valve goes. So you see it's inside his native valve, and as we blow up the balloon, it puts the new valve in position and pushes his old valve out of the way. And then we take the balloon down and get the rest of the system out of the way, and it's that quick. He's got a new valve that's working, and now he has, that valve doesn't have any stenosis, and so this is one of the really cool things about this is, we've been through both with him before, so he was better after his first surgery. It's just hard to tell until you get 3 or 4 weeks out and recover from the big operation. One of the really rewarding things about this is so many patients just wake up and they say, "Oh my gosh, I can tell the difference. I feel so much better." And so it really is very nice. And he's young, but a lot of our older patients are doing kind of like what he did, was they just keep pushing it down the line, and they feel bad, but they just think they're getting older.
Right.
And they don't seek help until it gets to be really bad.
I mean, this isn't the first patient that we've featured who thought a problem was just age.
Yep.
And it turns out there was something wrong with his heart. So is this the kind of thing, Dr. Wiley, that you're doing with Dr. Zorn? Like before you come to this episode of All Things Heart, you're in the OR doing this procedure?
We had a case this morning, and we have a few more this afternoon. So like Dr. Zorn was saying, it's a good team approach. I mean, we work well together.
How many do you do a day, would you say, on average?
So I would say on average we'll schedule 4 cases,
Wow.
Because that gives you obviously some time to make sure that you're getting through them in a good cadence and safely.
I want to get to our viewer questions. We're getting some questions from the community, and I'm also, I'll be checking my phone throughout this to check for our Facebook questions. Vicky has a question for Sean, and it is, when you were biking, you could tell your heart wasn't at 100%. So we've talked about that a little, but it was just leg heaviness, not pain in your chest. Is that correct?
That's correct. You have a sensation that your legs are heavy, and then you have a sensation that you're not catching your breath, but you're breathing fine. And my heart rate was always good. I wear a heart rate monitor when I ride. Heart rate always looked fine. So it's hard to pinpoint. It just makes you think you're out of shape. Even like no matter how hard you exert, you don't seem to make any gains. And it's weird. It's just a weird feeling.
Denise wants to know, she writes, a new heart valve seems daunting. What kind of restrictions does someone have after getting a new valve? Dr. Zorn or Dr. Wiley, you want to take it?
Yeah, I would say most of the restrictions are really just from what we were talking about, getting access to the artery in the leg. So we usually have people kind of lay low, don't really push it for about a week, and then slowly re-engage and exercise again. But short of that, really no major restrictions.
Jillian wants to know, what's the valve made of? Dr. Zorn?
Yeah, so this one has a metal frame, and then it has a skirt or a lining on the bottom around the valve that's made of different material. But the leaflet tissue itself for the valve that he got is what's called bovine pericardium. So it's not actually a valve from an animal. It's the lining around the heart from an animal that's made by man and constructed to work as a valve. There's 2 main valves on the market right now that are approved, and the other one is porcine, so it comes from a pig, but this one's bovine or cow.
Is it an invasive procedure to test for aortic stenosis? That's a question from Tom.
So it's a good question. So when we test for aortic stenosis, usually the first screening study is a surface echocardiogram. So that's not invasive. There are other parts of the procedure in the exam that are invasive. We'll look at the blood vessels on the heart, which means putting a catheter in. So by definition, it's invasive because we're putting something inside the body, but it's minimally invasive.
Minimally, and the procedure. I mean, it's just surprising to so many of us to see that you can do this all through the groin.
Yep.
You picture in the olden days cutting someone open, and that just doesn't happen for this. Jenny has a question for Dr. Wiley. She wants you to go over again, if you can, what are the symptoms of aortic stenosis that people watching should be looking for?
Yeah, it's a good question. So everybody presents a little bit different, but I would say the most dominant symptom is probably shortness of breath and fatigue. So it's a change in your day-to-day, and it's a slow progress. So sometimes people do attribute it to age, but it's really being aware, more self-aware. Kind of getting back to the question of exercise, one of the benefits of exercise is it allows you to establish a routine, and you know how your body reacts to exercise and how it feels. If you have a change in that, that's the red flag. But I would say the most common symptoms that we see is shortness of breath and fatigue.
Amelia has a question for Sean, and she would love you to go into more of what your recovery has been like. How long has it been since your valve replacement, and what has the recovery been like?
So it was done at the end of February, and during that time frame, so the first month I kind of laid low, and then I just slowly started building back up to riding more and more and making sure that I walked every day. And I made sure that I also tried to hit my step goal. I know that sounds simple, but just making sure that you go outside and walk and get outdoors and do things and move made a huge difference. And then once that kind of from that March to April timeframe, and as the weather started to break for summer, I got right back on the bike and started getting back out riding, and I just immediately started to improve fitness wise. And I'm still on that journey. I still have to make time for it, but man, it's a big difference.
John has a question for our doctors. John wants to know if you've seen an increase in health situations, dangerous health situations, because of people, just like Sean did, like a lot of us have done, putting checkups off during the pandemic. Are you seeing in your practice now people coming in with bad problems that could have been caught? Dr. Wiley, I'll start with you.
Yeah, actually, that's one of the things that we really saw at the beginning of the pandemic. So a lot of people put off seeing a physician, even if they felt bad, because it was that fear of going into public and fear of going into a hospital. So we would see people who were having chest pain for months not really get in to be evaluated. After things started to loosen up, honestly, we had a big onslaught of cases. I mean, so we saw the acuity on the back end. But yeah, it was a problem.
Dr. Zorn.
So I'd agree. I mean, the pandemic has changed so much of what we do, because we had the huge pent-up demand for patients because they were putting it off, and then they came back, but also all the supply chain issues, but also the issues, the stress on healthcare. So with really full hospitals, and so lack of access to beds, plus just the effects of the pandemic on our staff. So we have whether it's our nursing or physician staff, where they get sick too, and so we had people out, and it just put stresses in places that we haven't had it.
Well, thank God that we have a team like this that can handle all that. One last question for Sean. This is from Jenna. Jenna wants to know if you're back to 100%. How do you feel?
As far as heart goes, yes, I am back to 100%. Am I training like I need to be? Not yet. That's just all on me. But yeah, I feel 100% when I ride. I was out on a mountain bike ride at Clinton Lake yesterday, and just grinning from ear to ear and doing jumps and having fun on the bike, and that's a good place to be.
Maeve, I know you are biking right alongside Sean. Are you able to relax at all now, or are you still kind of white knuckling it when you see him out doing his thing?
No, I definitely feel like he's also enjoying it a lot more than that time where it's like, what's going on, and you start to get frustrated and not really enjoy it because you're like aren't having the best time anymore. And kind of like I was saying, like I always like knew that his valve wasn't going to last forever, and I was kind of like, ever since I'm like, how much more time do you have on that? And I was like, and then the pandemic hit, and yeah, I was pretty like, when I started noticing that he wasn't enjoying it as much, I was like, maybe the timeline meets up. You're probably pretty hard on that thing for 10 years. So, yeah, I'm glad we got it answered, and got it fixed. So,
yeah.
I want to bring Sean back in for some final thoughts. And Sean, I want to start with you, because one of the things that really stood out for all of us watching your interview back and being with you is how much your family and Maeve, you and Maeve, appreciated how Dr. Zorn treated you and reassured you. And you keep going back to how he treated you like a person. Can you talk a little bit more about that?
Yeah, there's nothing like having your physician or your doctor not talk to you like in so much technical terms, but make you feel comfortable. And like I said, Dr. Zorn doesn't go by Dr. Zorn to me, it's Tripp. And he, that's just, there's nothing that can beat that kind of like bedside manner where people are like treating you well. And the whole KU Med health system does that. You never feel like a number there. You feel like they're always there with you and trying to help you. And you can talk to the nurses' assistants and anyone that you get on the phone if you call and you have questions. It's always professional, but they make you feel like you're part of their team. So just kudos to KU Med and to all the docs there. And yeah, the pandemic's put a lot of strain on everyone in the healthcare system, but you guys rock it out.
Dr. Zorn, that's quite a compliment.
That is pretty cool. It's so awesome to hear somebody say that, because I do think we have a good team.
Yeah.
But it's not just docs. I mean, it really starts, even from the office beforehand, and the people who help us stay organized and get the patients in to see it, and the mid-levels, the nurse practitioners and the PAs and all the people that help us see, and then obviously the nurses that are involved in the care directly. It's been a really cool journey along the way, because this was really, this field of structural heart working with valves in this way was kind of the pilot program for the biggest stress for the heart team concept of cardiologists and cardiac surgeons really integrated and working together and almost being interchangeable at times. So it begins, we have clinic together, we operate together, and we see patients afterwards together, and there's no sharp divisions between disciplines that where patients can fall through the cracks, and it's a never-ending process of work trying to keep the machine working well, but it's awesome when people see it, because that's what we feel every day. Is we have some really good folks that we work with, and it's nice to see that in the patients too. So.
And Dr. Wiley, here at the University of Kansas Health System, that's one of the things that has always struck me, is how everybody is so integrated in relying on each other's expertise at every single turn, at every single level. What's it like for you then to be part of this and see it as a happy ending on the backside of it?
Well, I just feel so fortunate to be a part of the whole thing. Honestly, he and I started doing valve replacements probably 12 years ago, 10, 12 years ago, somewhere in that time frame. And just having the team and the system, and I can't imagine really working anywhere else. It's just a great place to be. And like Dr. Zorn said, Tripp said, from its nursing staff, its front desk, it's even the patients, having the courage to come on and have these stories and have this conversation.
And we know Sean is back riding with Maeve, which is awesome. Sean is super active, and so are Dr. Zorn and Dr. Wiley outside of the hospital, which is what brings me to the next segment, Behind the Mask. We love this segment. So when we get to give our viewers a peek at what our doctors are like when they're not saving lives and working on hearts. So take a look at this picture Dr. Zorn shared. It's him on his most recent hiking adventure, and who's that guy with him? Oh, it's Dr. Wiley. So you guys are friends in and out of the hospital. Where was this taken?
Yeah, that was in Yosemite right after I rescued him from falling over the edge. I pulled him back. He almost died, but we saved him, and so yeah.
Forgot about the part where I had to carry him up the hill.
Right.
His backpack.
He rescue
pulled
operation.
a hammy. I think he cramped.
Do you guys do this all the time? You guys take like bro trips out? You bring your families? What is it?
We've been at it for a while. So, we started doing these kind of, we used to call them off the grid trips, and then we couldn't really show like a lot of the pictures of where we actually stayed sometimes, because they weren't always completely off the grid, but
right.
They tend to be hiking trips and just kind of getting out and really pushing our bodies a little bit and having more than just a trip to a resort.
Do you guys get helicoptered in anywhere?
We talked about it.
Yes, the goal is not to get helicoptered out. So that's the goal. But no, we haven't gone to that length.
Not yet.
So,
Where are you going next?
That's under
we have a steering committee. It's an official steering
discussion.
committee. So we can't disclose any of the discussions.
We need a couple bottles of wine to make the final decision. So.
Okay, well, we'll take those here. No, we want pictures for the next one. We want more than one. More than one. Thank you so much for being with us today, Dr. Zorn and Dr. Wiley. We know you guys are super busy, hence the scrubs. You've got more procedures. Thank you to Sean for sharing your story. We're so glad you're back on your feet and on your bike. We couldn't do this program without any of you, so thank you for your time. Coming up next week on All Things Heart, thank you. Coming up next week on All Things Heart, a deadly problem in our communities.
It takes all my problems away, it takes my pain away. I don't really worry about anything.
She just turned 18, she's addicted to pills, and she's pregnant. And just one of these pills every single time could be deadly. The growing danger of fentanyl to our children and how it affects your heart next Thursday at 10 a.m. We'll see you then.